Thank you for joining us this evening for Let's Talk Lupus Disease Awareness webinar. Tonight's topic is chiropractic care and lupus, and our presenter is Dr. Heather Bailey. Dr. Bailey graduated from the Canadian Memorial Chiropractic College in 2012 with both honors and clinical honors. Her undergraduate degree is in Human Kinetics, Kinesiology from the University of Windsor. She has a very strong exercise and rehabilitation background and believes the key to any successful recovery comes with changing how the body works through exercises. Just a few housekeeping items to address before we begin the webinar. Please note that all attendees are placed in listen-only mode. Both audio and visual have been disabled. Should you have a question, please post it in the chat box and we'll do our very best to address your questions before the end of the webinar. We hope you find this webinar informative. I will now pass this over to Ariana Ranjbar, who is our moderator for this evening's webinar. Ariana?
Thank you, Leanne. Hi, everyone. Yes, so my name is Ariana Ranjbar, and I will be your moderator for this evening. So if you have any questions throughout the webinar, please feel free to put it in the chat box, and I'll do my best to address any urgent questions. And then any questions you have in general, I will address to Dr. Bailey at the end of the webinar. And now I'd like to please welcome Dr. Bailey, who will be present the benefits of chiropractic care.
Okay. All right. Hi, everybody. Hopefully everybody can see myself and the screen okay. Is everything showing up on your end, Ariana?
Yes, it looks great.
Perfect. So first of all, I just want to thank Ariana and Leanne for inviting me to do this tonight. Super excited to be able to talk about chiropractic with everyone and hopefully answer any questions that you have. So welcome everyone and thank you again. All right, so first things first is just a disclaimer that this presentation is designed to be informative, but is not offering personal medical advice. So nothing that I say here tonight is supposed to be taken as personal. If you have any questions, again, at the end, Ariana will help me address them and also will share my contact information. So if you would like to get a hold of me and ask some more personal questions, I'm happy to sort of oblige. So Leanne did a great job of introducing me, but who am I? I am the chiropractor. As she said, I graduated from the Canadian Memorial Chiropractic College in 2012. So that school is down at Steeles in Leslie in Ontario. I am a medically minded chiropractor, so I work out of a family physician's office. I'm here in Newmarket, and we have 3 family physicians, so I work in conjunction with them. I'm physically active. I was a personal trainer for many years before getting into the chiropractic and kinesiology world. So I really believe in exercise and, proper exercise prescription as part of rehab and treatment plans. I'm also a hiker and a horseback rider, so I love me some outside. I'm an animal lover. I have a dog, a cat, and 2 horses, which just take up a whole ton of my time and my life. So that's who I am in a nutshell. Next slide, I just wanted to know, Ariana, if you could set a poll out. How many people have visited a chiropractor before? So we'll take a couple minutes, and if you guys want to type in your answers in your chat box, that would be great.
I'll just wait a few seconds. Someone said that they have seen a chiropractor before.
Just one person so far?
So far, multiple people.
Okay.
4 or 5 people, yet more than that actually right now. Everyone has said yes so far.
Everyone has said yes so far.
Yeah, we just got a bunch at once. So everyone said yes, me too, and I have.
Okay, so a lot of people here are sort of familiar with it a little bit. For those of you who haven't been to a chiropractor, and even those who have, hopefully I can provide some information. So one thing about chiropractors is a lot of people think that we are limited to back and neck pain, so spinal pain, which is not the case. We sort of work on anything that is neuromusculoskeletal, or to put it in English, that's joints, soft tissues, and nerves. The joints are typically connections where 2 bones meet, so anything that moves, soft tissues, including your muscles, ligaments, and tendons, and then your nerves are, what's supplied from the spine. Many people think, it's just the back pain, but I work on ankles and wrists and knees and shoulders and all of that kind of stuff. So pretty well anything that's moving in your body is sort of under the scope of practice of a chiropractor. And then manual therapy. So we are manual therapists in the sense that we do things with our hands. There are some chiropractors who do adjusting with different instruments and sort of applications, but most of us will do things with our hands for the most part, for the majority of our treatments. We are also drugless practitioners, meaning that we do not prescribe medication or recommend medication as part of our treatments. So for people who are on a whole bunch of medications, and we'll talk about this a little bit more at the end, there is no additional sort of medical co-founding variables with it. Typically what happens when you come into a chiropractic office is that the chiropractor will take a detailed history. So find out everything about your previous medical history, your current complaints, as far as surgeries, traumas, all of that kind of stuff goes, your medical history as far as your family goes. Hopefully talk about your sleep patterns and the aggravating factors for you and the relieving factors for you in order to figure out what's going on. And a lot of people will be able to figure a lot out from just the history itself. Then they move on to a detailed physical exam, and this is sort of the basis of look, feel, and move. So examine the area, take a look at what's going on, have a feel for what's going on. So sort of some palpation of the area and trying to sort out what feels good, what doesn't feel good. And then same idea with the movement part. That involves usually some orthopedic exams and some muscle testing to determine, what is the cause and the root of your problem. Then we move on to a report of findings. So should sit down and talk to you about what you found, what was in the exam, all of the things that were positive as far as the orthopedic tests and as far as, feeling things that didn't feel quite right. And at this point in time, the treatment plan will be delivered or sort of explained to you. And that will also come with the risks and the benefits, along with how long you should be expecting to be in care. I think you heard Dr. Steve from The Simpsons saying, I need to see you 3 times a week for many, many years. That's not typically the case with most people. Most people, it's, a very time-limited plan that should get you back on your feet within a certain period of time. And of course, there's ongoing and chronic conditions that always require follow-up, but 3 times a week for many, many years is really not a very acceptable treatment plan. So moving on, excuse me. So treatment techniques, there is a ton of variability within the profession. So if everybody said that they've been to a chiropractor before, you're going to find that one person who went to a chiropractor had a very, very different experience than somebody else who went to a different chiropractor. Even sometimes somebody coming into my office will have a different experience than somebody else, just depending on what their condition is and what's required. But there's sort of some similarities between a lot of them, and it just depends on the particular practitioner and what their preference is. So some things that some chiropractors will do, soft tissue therapy. So that's working on the various muscles and ligaments and tendons and nerves and all of that kind of stuff to typically relax it. Not everybody does this kind of stuff, but a lot of people do. I'm one of the people who typically tries to throw in an amount of soft tissue therapy along with my treatments. Joint mobilization and manipulation, and this is sort of the bread and butter of being a chiropractor. This is what we are really, really, really good at. I know some physiotherapists these days do some adjusting. Chiropractors typically have a little bit more training and experience in doing the adjustments. So this is taking a joint and finding its range of motion and restoring the range of motion. So when we find a joint that's not moving the way that it should, we go ahead and get it moving again. And that's where that popping or cracking noise is that Dr. Steve was talking about. It is not actually anything cracking, it is just gas being released from the joints. A lot of chiropractors, again, do it manually with their hands. Some of them do it with instruments. I don't particularly use the instruments, but some chiropractors do. And some people like the instruments better than the manual stuff. Again, it's all very varied between the profession. Rehabilitative exercises, that's something that I think is really important with any treatment plan. Again, not everybody includes it. For me, this is sort of a huge, huge deal because in my opinion, unless you are changing the way that the body moves, you're just going to end up back in the same kind of stuck position that you were before. So figuring out ways to change the mechanics of your body to improve the overall quality of your motion, I find that really important. And then some other chiropractors, I don't use the electric modalities just because I'm not really set up in my office to do so, but a lot of chiropractors will use like TENS machines, like the Dr. Home machines, or like super powered versions of that called IFC, or therapeutic ultrasounds or shock waves and that kind of stuff. So again, you know, across the profession, you're going to find a really wide variety of different treatment programs. And I always say to people that I think the most important thing is to find a practitioner that suits you. So to find somebody that suits your body and your needs and what feels good to you and what doesn't feel good to you. Because if you've tried one and it didn't work for you, there's lots of other people out there who have probably a lot of different techniques and ways of going about things. All right, so a couple of things about chiropractic. So pain control is a huge reason why people would go and see a chiropractor. And that is, you know, for a couple of reasons. Decreased sensitivity to pain. So proprioceptive sensitivity is basically just meaning that your body tells your brain information about what we're experiencing in the day-to-day world. And I'll get into it a little bit more in another slide or two. But basically, with the adjustments and with the treatments, typically we get a little bit of proprioceptive sensitivity decrease, meaning that our body isn't quite as sensitive to pain after the adjustments. Also, again, with the adjustments, improving the range of motion after treatment. So now if a joint was restricted and then we move it, well, now you're going to have more freedom to move around and be better able to move around after your treatment goes on. So yeah, it's just typically a little bit less sensitive to touch after treatment. Okay, and by the way, the numbers are references. So if anybody wants to read the papers that I sort of pulled this from, just as some backup so that I'm not just talking out of thin air, there's a list of references at the end. So reduction of inflammation. So there's been studies, and there's multiple of them. I just pulled one reference out, that synovial inflammation is decreased after manipulation. So what synovial fluid is it's the fluid between any synovial joint. So synovial joints are joints that move, which are most of our joints in our body. If we think about a non-synovial joint would be the bones in your skull. So we actually have multiple bones in our skull and they are attached, but they do not move. If they're moving, you have a bigger problem. You need to go see somebody else other than a chiropractor. So synovial fluid is sort of the fluid in between the joints. Your joints contain a capsule, there is cartilage, and then this fluid inside is basically like oil. So the oil sort of lubricates the joints in order to help them move a little bit. Now, sometimes with injury or trauma or just lack of movement, sometimes the joints become inflamed. And I'm sure a lot of people who are listening to this chat are probably nodding their heads right now and going, yeah, I have inflamed joints. Because also very, very common with inflammatory arthritis and autoimmune disorders. So having this fluid inflamed in your joint obviously causes some swelling and causes some causes some increased symptoms of pain, because the swelling obviously creates a signal to your brain saying it hurts. So they've found with the adjustments, it actually decreases the inflammation as it actually starts getting things moving through the joint again. So now you're decreasing the amount of synovial fluid that's in the joint, moving fresh fluid into the joint and better able to decrease that inflammation. All right, so the CNS and the pain pathway, your CNS is your central nervous system, so that's part of your brain. So what happens basically when someone is in pain is you have these proprioceptors in your body, you have these receptors that send a signal up to your brain saying, ouch, something hurts. And then your brain sends the signal back down to your body and goes, yep, it hurts, stop moving it. So that's why when we're in pain from, injury or trauma or inflammation and all of that kind of stuff, everything hurts so much is because your body and your brain are forming this continuous sort of pathway saying, okay, it hurts, stop moving, and then you stop moving and then it hurts more. So it just becomes this perpetual cycle where things get worse and worse and worse. So one of the things about an adjustment, which is really cool, is the whole unplug it and plug it back in theory. So you can just kind of reset that whole pathway, and it's not going to say that your body's going to stop sending that signal completely, but it does give a little bit of a break in that pathway for, a period of time to at least allow you to feel a little bit better. And that's, like I said, when the exercises take place and teach your body to, move again in a proper way and be able to move without pain. All right, and again, I think there's a question period at the end, so if I've gone too fast over anything, or if you have further questions about it, feel free to ask questions at the end. So functional and inflammatory conditions, there have been multiple studies done showing that people with inflammatory conditions and autoimmune conditions, the inflammation, again, the same as the synovial fluid, reduces after having an adjustment. So the adjustments are beneficial in that way as well. Okay, so some things that are probably very relative to everybody here listening tonight, or people who are supporting those with lupus. Three things that are very relative are joint pain, fatigue, and joint swelling. We've already talked about this a little bit, but I'm going to get a little bit more specific with potential benefits for people with lupus. So obviously, chiropractic care is not going to cure lupus. I wish there was something that I could do, but it's out of my control. However, there is still a possibility of benefiting from the chiropractic care in the ways that we've talked about. So pain control, being able to reset that pain pathway, decreased use of medication. So I know everybody with lupus, or at least people who have been experiencing it for a long time, are already on a lot of medications. If you're able to decrease the amount of pain medication that you're using, or at least the quantity, or how often you're taking it, would be a huge benefit, I think, to most people with lupus, which also falls into the whole prescription cascade. Now, for anybody who doesn't know what the prescription cascade is you take one medication and it has a side effect. So then you take another medication to manage that side effect, and that medication then has a side effect. So then you're taking a medication to manage the third medication side effect, which may also have a side effect. So the more medications that you're taking, the more side effects are potentially available, or potentially, causing problems for you. So if you can decrease some of the amounts of medication that you're taking, sometimes it's able to get off not just the pain medication, but sometimes some of the side effects that are associated with that. Now, I'll put in the caveat again that this is not advice to get off of your pain medication. And if you're considering doing that, you definitely need to go talk to your GP. But there is the potential in sort of helping with pain control. As we discussed before, decreased inflammation, improved function, so being able to move better and having better range of motion, which also leads to more exercise comfortably because you're in less pain, so now you're able to do more things. Increase your cardiovascular fitness, which also has to do with, fatigue and your ability to do things throughout the day and continue and progress throughout the day, which is overall, a benefit to quality of life. So I have a couple sort of just general stretches. Everybody's listening to presentations. We're all working hard these days. So I thought Ariana could maybe just show a couple of videos of some very basic stretches. You're welcome to try these at home. If you're concerned about it, feel free to talk to me afterwards or your GP, or, have a look at them and just think about them for a while. But definitely, as I've been promoting exercises, I thought a couple of these should be thrown in. So Ariana, I'll let you take it from here.
Absolutely.
Time for some wall angels. With the wall angels, you're gonna lean up against the wall and you can walk your feet out as much as you need to. What you want is your lower back to be flush to the wall, head against the wall, and chin tucked. Now, if it's hard to do both, you're more than welcome to put a small towel behind your head, okay? What we're doing is we're stabilizing the neck and the lower back to allow that mid back to move. So you're gonna have your chin tucked slightly, lower back flat, fingertips on the wall. What we're gonna do is you're gonna come up, keep your lower back flat, take a breath at the top, really pulling the ribcage down, and then back up. You can also play with the angles. If it's uncomfortable to go straight up, you can go out to the side about a 45-degree angle like this. There it is. It's a great one. Have fun with it and be kinetic.
This is a sideline hip abduction exercise, which is a lower level way of strengthening your gluteus medius on the side of your hip here, which is important to have strength in that muscle for running, jumping, walking, most activities. You want to make sure that you have nice strong hips. So the way you're going to do this is lay down on your side. The top leg is going to be the leg that you're strengthening. You want your hips stacked straight up towards the ceiling, so you want to make sure you're not rocked back too far. Your bottom leg can be bent to help you balance. Your top leg is going to be straight with your ankle flexed so that it's pointing straight forward. And then you're going to raise your leg up and slightly back and back down. Up and back. And you should feel it right in here. And that's your sideline hip abduction exercise.
All right, thank you, Ariana. Can you see my screen again?
Yes.
Yeah, okay, perfect. So those are just a couple sort of very basic exercises. Wall angels is one of my favorites, and there aren't very many people who leave here without getting taught how to do wall angels properly. It is a great exercise, especially for people who are sitting or anybody leaning forward all day long. Really was one of my favorites. So if you haven't taken anything else away from tonight, take wall angels with you, because it is a great exercise. Again, don't try it if you have any kind of medical reason not to, but still love that exercise. Next screen is just my contact information, and I believe that this is available through Lupus Canada, or seeing this presentation again. But if you want my contact information, here it is. If you have any sort of specific questions, I'd be happy to try and address them to the best of my ability. And then I do have references at the end here for anybody who wants to go through what I was talking about. And otherwise, I will sort of open the floor up to any other questions.
I was just saying we'll wait a few minutes to maybe see if
Okay.
anyone has any questions. But until then, I just wanted to remind everyone that Lupus Awareness Month is in May. So Lupus Canada has a lot of initiatives sort of going on. We'll have a slider and a tab available on our website as of May 1st. So please check out our website to get more information about the initiatives. And you can follow us on social media platforms, Instagram, Facebook, Twitter, LinkedIn, and YouTube for also up-to-date information and any resources that we try to share throughout the week. So, someone asked if you would be able to put up your email address again.
Yeah, sure. Give me 1 second.
Yeah.
There we are. There's my contact information. So I'll just leave this for another couple minutes, I guess, while we're getting some more questions.
Someone said thank you for taking the time to speak with us, Dr. Bailey. And then
My pleasure.
Someone said, question, would you suggest once a month for having an adjustment done for a lupus patient?
I think it's very, very specific. So it probably would be something that you would want to talk to your healthcare provider about. Again, they would go through a detailed history and physical and talk about your particular complaints. I definitely have people who come in every 2 weeks here. I have people who come in once a month. And I have lots of people who just call me when things are bad. Everything is sort of specific to you and your condition and how you want to manage it. I do find that people who are doing more stuff on their own, so again, with the exercises and strategies and lifestyle management, which is another thing I should talk about too, is also, changing the way that your desk is positioned and that kind of stuff. All of that leads into it. So it would be a very specific thing for your particular case.
Perfect, thank you. And then, so I might say this incorrectly, but someone said I have bilateral hip bursitis and mild osteo. Would chiro be beneficial, trying to avoid steroid injections?
Yeah, definitely, definitely within the wheelhouse of chiropractic. So yeah, definitely some conditions that would be worth investigating. I don't know what this person has tried previously, but yeah, absolutely. And also I will mention too, people are outside of the Newmarket area and they would like a referral to different chiropractors. I know a fair amount sort of around Ontario, even a bunch in Canada and the US. So I would also be happy to try and make some suggestions if people want to get in touch with me.
Just wanted to mention as well to everyone that this webinar has been recorded and will be available on our website within about 24 hours. And so all the information that Dr. Bailey has so graciously shared with us today, you can go back and look at along with the links. So if you want to go back and look at some of the exercises she was mentioning, you can do that at your own speed, and we'll have those up within about 24 hours.
Awesome. Thanks, Leanne.
And someone just said that their daughter was referred and it helped a lot with their inflammation. Yeah, they think it's great. And then someone asked, what can you suggest to strengthen your lower back? I don't know if that might be difficult because that might be like an exercise specific question, which I don't know if.
It is. It's an exercise specific question. There is a great resource. It's another program that I work for called the Low Back Rapid Access Clinic. So I'm going to say that a lot slower. The Low Back Rapid Access Clinic. And if you were to do a Google search on the Low Back Rapid Access Clinic exercises, you'll get a link that pops up that has a whole bunch of videos, and it's all sort of low back and core strengthening. Through the program, we sort of assign people based on what their condition is. So again, after doing like a physical assessment and that kind of stuff. But if you want to just grab some generalized low back exercises, there's some amazing videos on that link.
We'll also post that on our website.
Sure, great. Yeah, I'm going to crash the system. It's an Ontario funded program. I'm going to crash the Rapid Access Clinic website. Perfect.
And Dr. Bailey, you touched upon it, but I know when we read a lot about and hear a lot about people that are sitting at a desk for long periods of time, or maybe working on a line or standing for long periods of time. Obviously, I would imagine the suggestions would be to get up, do some stretches, move around, so you're not sort of staying in one position for too long.
Absolutely. And even reversing a lot of the postures. So I'm going to turn to the side for a second. Can you guys still see me on the video? Yeah?
Mm-hmm. Yeah.
Okay. So even, after sitting at the computer all day, I'm kind of sitting like this. So you get shortened muscles in through the front here, and you get shortened muscles in through the front here. And then you get sort of weak muscles in the back and in through the shoulder blades because of this posture. So that is one of the reasons that I love the wall angels, is because you literally just do the reverse of all of that. And a lot of people who have the back pain, they end up sitting in a chair and they sort of stretch forward and round their back out because their back hurts. when a lot of the time what people need to be doing is leaning backwards and going to extension and just changing that whole posture. And you'll find that that gives them a lot more relief than doing more of the same kind of tucking forward thing. But again, you know, specific, right?
And I would imagine too, there's exercises available for folks who might be in a wheelchair and unable to, do the standing exercises.
Absolutely. There's lots of modifications that are available. Again, I mean, this is all that's specific, which is why we give the disclaimer at the start that none of this is personal information, but there's always modified versions of exercises to do. I used to work with a cardiac rehab program, and we had people who were doing them on the floor. We had people doing them while they were standing. We had people doing them while they were sitting. So it's just finding the appropriate modification.
Perfect. Great.
So we don't have any new questions yet, so I don't know if Leanne, if we want to perhaps wrap that up.
Yeah, we can definitely. I want to say thank you so much to Dr. Bailey. What an informative webinar. Thank you so much for taking your time to share this information with our group. And as I mentioned earlier, we will put the presentation with all the links that we've talked about here today on our website. And I think I see something in the chat. Ariana did something.
Yeah, someone just said that they missed it because of their time difference, but they have a series of information. So, and they're tired a lot of the time, so they'll be doing these exercises. They asked, will doing these exercises add more pain to their information?
Again, I keep saying this, and I'm sorry to be so repetitive, but it's all very case dependent and very specific to the person. But in general, I mean, we know that any kind of increase in exercise increases our stamina. Cardiovascular exercise also increases our ability to do more things. So as a general front, yes, exercises will increase your ability to do things. But again, it's going to be very specific as to what exactly you're going to want to do.
And that's why it's so important for everybody to speak to their healthcare team, speak to their chiropractor. As we know, lupus affects everybody so differently, and every case is so individual. So to speak to your healthcare team, and hopefully the right treatment plans can be found that can hopefully also incorporate some chiropractic care.
Thanks, Leanne. Well said.
I believe that might be the end of our questions. If anybody should have questions following this webinar, please feel free to send them to info@lupuscanada.org. We're happy to address what we can, and then we'll also speak with Dr. Bailey if we're unable to address them. But once again, thank you so much, Dr. Bailey, for your presentation this evening. We hope everybody found it informative, and it will be available on our website within about 24 hours. And our website, for those of you who are unaware, is lupuscanada.org, and you can find this and many other webinars on our website. Thank you, Ariana. Thank you, Dr. Bailey, and thank you to everyone who attended.
Yeah, thank you very much. Yeah, you too.
Take care. Bye-bye.